Our first speaker is Dr. Nagarathna, Dean of Health Sciences of VYASA, and Srimati Ashwini Surpur, Director of Yoga Therapy. For Yoga Bharati, we'll be covering yoga therapy for common alignments. Dr. Nagarathna will explain the yogic concept of stress and its effects on human philosophy, and Ashwini ji will talk about how Yoga Bharati has replicated the VYASA model of yoga therapy in America. Ashwini ji will talk first.
All right. Thank you very much, Asta, and I welcome you all to this session where we talk about the experience that we are going to share, that I'm going to share about the yoga therapy that we have conducted for the last 4 years here in America and here in Bay Area. We are three of us who started out yoga therapy sessions, and with a lot of trials and tribulations, we finally have been, I would say, successful, reasonably successful in conducting quite a few therapy sessions and replicated the model that VYASA follows, though not in the same way, in a different way, but mostly giving all the same sessions, including yogic counseling. So therapy classes started in 2008 actually, but I would say in full-fledged way in 2009. And even before that, we used to bring some experts from VYASA in Detroit and Houston and places like that, where they used to conduct back pain classes occasionally when they visit Bay Area. So it was just on and off for the last, I would say 10 years, but only recently, that is last 4 years, we have been running full-fledged therapy classes. And we basically started out the classes with back pain classes, and then we moved on to asthma and allergies, obesity, weight management, workshops, yoga for kids, and common ailments classes since then. And I do not want to spend too much time on this, but you would guess by reading what is the, we have collected some statistics, not a whole lot, but from that we can say that it's basically 70% of them, or even sometimes even more than that, are women. And we have adults, we have covered so far more than 250 adults. And we have about, I have put 20 kids here, but actually we have covered close to 100 kids in terms of yoga for kids in general, and probably even close to 200 kids for yoga for kids in terms of camps and various other sessions. But 20 children are these people who have various ailments and issues we have addressed for them, including even the autistic kids and stuff. So we have also done regularly, we have conducted yoga for seniors at ICC, India Community Center. So if I add that number, it will turn out to be much more, but these are yoga for senior classes in other places other than ICC. So we have covered back pain. There was a significant improvement in back pain classes, that is therapy participants. Obesity, and we have combined obesity, thyroid and metabolic disorders. And overall health improved, but we could not see a significant decrease in the weight reduction, partly because most of these people who come to our classes are busy people. They cannot keep up with the diet changes and stuff that we recommend, and also many of them cannot keep up with even the regularity. But we have seen that the regular committed participants have shown significant change in their weight. And but we could see that even though the weight did not change, their overall health improved. And we could, for diabetes patients, we have had significant change in their sugar levels. And for asthma and allergies, committed participants have definitely shown a lot of improvement. Again, here also commitment is a big issue when it comes to Bay Area and the fast-paced lifestyle. That is one of the major challenges. So in comparison with VYASA and the Prashanti Kutiram, the Arogya Dhama Health Center, where it's a residential center and the participants get full care and they cannot go anywhere and do anything else other than therapy. So there we see, compared to that, we see a lot of challenges. But I think the difference that we have made in their lives, even with this busy lifestyle, is pretty significant. I won't read the slides, I'll let you. Then we have also seen patients who have had cancer, breast cancer significantly, and of course in a couple of cases even the brain tumor. And we have seen arthritis, pretty common, and most of our adults are in the range of 40s and 50s. We don't have a very senior people coming to our classes unless we go to the senior centers and do the classes. So that's one of the things I wanted to bring to your notice. And of course we have all these different various other disorders, and you see the numbers already. And this is the graph that shows what we have in terms of number percentage, how it is distributed. That will kind of give a picture. And as you can see, adults, when I say, it's mostly in the range of 30s to 50s. That's the range. And seniors, we have covered mostly going to senior centers. And we'll be having yoga for women at that time. One of my colleagues, she's going to cover, Savita Joshi is going to cover on women and prenatal. And what did we give? Yoga intervention. It consisted of, we start with the prayer, we end with the prayer. It's mostly mantras of peace. It's not so much religious. We try to keep the religious stuff away from it. But the chanting of Om and the chanting of Shanti mantras, we don't consider that as religion, so we bring them in. And we have asanas. We start with breathing, loosening. These are little, our breathing is awareness building practice, and of course loosening is just to loosen them. And then we go into asanas, and we focus quite a bit on relaxation techniques. The more chronic ailments such as arthritis and back pain, we go deeper into relaxation techniques. And for anxiety and other disorders, we have what we have kind of named them as yoga for core strength and yoga for endurance. These are the names we have given, and in the bracket we give all these common ailments underneath. But basically when we say yoga for core strength, these are mostly lying down practices and a lot of focus on the core and back and relaxation techniques. The more chronic the ailment, the more deeper we go into relaxation techniques. And for anxiety patients, we kind of make it a little more dynamic and a little more loosening oriented. But our relaxation techniques like deep relaxation technique, DRT, the pranayama, and MSRT is one of the very popular techniques that VYASA has invented, and people use it. It's called mind sound resonance technique, and through the course you will probably hear this name again and again. It's basically simple chanting of akara, that is a, u, and aum. This is as simple as it can get, but the effect that we have had on this is just simply profound. I'm going to give you some case studies on that. Cyclic meditation, there is a session on that also. We call it yoga for stress in the afternoon. You will see cyclic meditation being conducted there. So we conduct that. That's also seen to be very popular. And then we have Om meditation, which is basically chanting of Om many times initially, then slowing down, increasing the space between the Oms, and finally leading to silence. And we have pranic energization technique. All of these are pretty much VYASA techniques. If you happen to go to Prashanti Kutiram in Bengaluru, you will see much more of these sessions throughout the day. And then we have yogic counseling, which we give primary importance. We start the session with yogic counseling. Every month we kind of go on talking about it. Even during deep relaxation, we do emphasize on what we call self-transformation. And then talking about how the effective therapy, what we have done in comparison with, again, Prashanti Kutiram, where everything is residential and they can give it in-house. But here, what we have done is we ask them to attend weekly twice a session for 3 months. That's where we give significant discount, which is actually 40% discount. So people do tend to use that. And for that, we'll also give them a home practice kit. So this will be pictures and instructions, and we design for each one of them depending on their condition. And we'll not give them initially. First couple of weeks they come, they practice, they see how it is, and then we give them home practices. And of course we focus on yogi counseling one-on-one many a times. Although the charges are done per class, which is, considering in America we just say, okay, 1 hour class, we take 1 hour 15 minutes, the classes are 75 minutes long, but they go anywhere from 2 to 2.5 hours, considering all these yogi counselings. After the session, we even choose to talk to them to address their issue. And the effect of yoga therapy, I think we have covered this. I just the children-related stuff. And we have seen significant change in the lifestyle of people and the feeling that they have, especially in cancer and ailments such as that. In congenital disorders, however, we could not see a whole lot of difference, partly because it is congenital and it takes a long, long time, and we have not had that kind of staff or facility to provide them that much treatment. Then we have, for anxiety disorder, we have seen an amazing change. Anxiety patients immediately, the effect is very, very immediate. They just come back next class and they smile. In fact, one of the patients who was saying she's scared to go to stores like Target where there are a lot of people, and then she would think that everybody's mad with her. And the next class, the very next class, she came back, this was an OCD patient, and she come back and said, you know what? Yesterday when I went to Target, I felt everybody was laughing, smiling at me. It was just, I don't know whether it's just me or people were really indeed happy with me. Maybe it's my face, maybe something, I don't know. So that kind of effect on people with anxiety. We have had a very successful case where anxiety patient, very, very, in fact even chronic genetic issue, and this person even joined our yoga teachers training, and she's now an extremely happy camper and a yoga teacher. And seniors, regular attendees at ICC have always had smiles on their faces, and I would, I don't know if Gopi Godwani is here, but basically says she has maintained a whole family there, and all our Yoga Bharati teachers have gone and taught ICC senior classes, and it's just one bunch of happy people simply because they practice yoga regularly there. And we have also participants who attend 2 to 3 years, and they have definitely seen that their work is getting more, they are productive, much more productive in life. And the kids, we have our Yoga for Kids teacher here, Madhavi, who has conducted yoga classes for kids for almost 2 years. And overall personality development, we focus on the parents, and we see that the parents are much more stressed in many cases than the children, because they have been pushing their children to do better, and we then sit down with the parents and explain to them that success is not about how much A's their children get, but it's about how happy they and their children together are. So we do take a lot of effort in trying to address the issues as a family when it comes to children, because children themselves may not be really in trouble. Many a times when the parents bring their children and say, my child is not focusing, my child has a problem, we found out that it was actually the mom that has a problem or a dad that had a problem. So we have addressed those. And just a few testimonials. We had back pain, one of the very big success stories for us. She was paying 24/7. She was in pain. And when after about 6 months of committed practice, the model that I explained earlier, that is home practice and yogic counseling and the whole, she followed all of that model, and in about a year's time, she was completely pain-free, and she moved from the yoga for back pain to obesity practices, which involved much more practices, more dynamic, and she was able to do all of that. And we had a woman, I don't know if Beena Desai is here, but her person, she is one of our therapists, and there was a wheelchair-bound person, could not even stand up, and the last time I visited her studio, I could see that she was doing the asanas just very, very well. So we have such cases, and she was saying the deep relaxation that she got for the first time simply opened her eyes up, and she says, I've never tasted anything like this before. And this is a significant study. I hope Indra Singhal is here. Basically, he presented this self-data. I don't know how nicely you can see. Basically, it's a 1-year data on blood pressure readings. And he has taken our Yoga Bharati classes, and he saw that in about 7 months, that first 7 months, that was when he was practicing yoga. And then for some, basically because the venue was not available and all, we had to stop the classes and see his blood pressure reading after he stopped the yoga classes. And that is the average of 2.5 hours per week. And he has presented his own data. And this shows how what is the effect of yoga. And we have, I just rushed here. We have Ankita, one of our Yoga Bharati kids, and she had severe allergies, the eye issues, watery eyes and whatnot. I really wish I would bring her here. After about a few yogic counseling, including a phone call with Dr. Nagarathna Didi, who is here, she is totally confident. She's so confident about being able to handle her health that she's even started eating the foods that she's allergic to, and she's doing fine actually. And she says, "No, I'm going to be fine." And she closes her eyes, focuses and relaxes, and she just tells herself, "I'll be fine," and she'll be fine. It's amazing. That was thanks to Dr. Nagarathna. And we also have another child here. Again, these kids are running around everywhere. Sushant, who is also the Yoga Bharati kid, one of our volunteer son. And he was so scared recently because he took an intensive course on algebra and realized it was too hard for him. And he was ready to give up, crying and whatnot. The mom said, practice MSRT, Mind Sound Resonance Technique. And this summer he finished the course with an A. And that article is published in the Souvenir. Take a look at it. And from illness to spirituality, we constantly give yogic counseling in a way that they do not just come here, do some practices and feel better and go home. This is not a physical practice. We always say that if you want physical practice, go to gyms. In fact, they will do exactly same things. They will even do to the, if you are having a back pain, they'll give same stretches that we do. But there is a difference and things like that. And we give them a lot of yogic counseling. We also send them to various retreats, Ayurveda, and we recommend Ayurveda along with yoga and whatnot. So they have basically seen a lot of results there. Challenges, I don't want to be negative, but then challenges do exist. We do have a cost of running. We have been running in our garage so far, and we tried moving to a venue, cost, and then constant marketing. We are just a bunch of volunteers, as you can see. We are not so much into business making, money making business people. So it's kind of hard to focus on the aspect of self-growth, spiritual growth, being very kind, all of our therapy teachers here, if somebody comes and says, I cannot pay, they just don't accept money. So it's in that kind of scenario, it's very hard to sustain. So we have seen those challenges. People are very, very busy, even to come to yoga classes in the Bay Area. So they do come, they drop out. So sometimes it's just extremely difficult to run these in a very studio-centric situations. So we have too many yoga studios around here, too many brands, but unfortunately people don't know what is the holistic practice and what is the importance of, focusing on philosophy, on the roots and all that. So it's kind of hard for us to tell them the difference, but once they attend even one of our classes, they will know the difference. But to bring them to the first class, a lot of marketing shouldn't go behind, and we have run out of bandwidth. And as you can see, America, or nowadays even the whole world is turning out to be becoming a quick fix society. So everything has to be quick and quick band-aid and quick one tablet and everything will be okay and I'll move on. So that is how the society has become everywhere, not just in America. But so yoga is a slow process and it takes time for us to get there. But I think we are getting there. Thank you.
Now I will invite Dr. Nagarathna to come speak.
Brahmanandam Paramasukhadam Kevalam Jnanamurtim Dvandvatitam Trigunarahitam Sadgurum Tam Namami. Friends, this track, the topic is, next slide. I'm supposed to share with you the experience at VYASA on common ailments, and as you have been hearing, we have been doing yoga research in this field for the last 25 years. We have just completed our 25th year. Here are some of the data. As Ashwini has been mentioning, we have a 250-bedded facility where patients flow in every week on a Friday, and they get admitted for a minimum period of 1 week, Friday to Friday. They reach at lunchtime and they start off the routine with all the registration, medical checkup, data taking, measurements, etc. And then by evening with a introductory talk and relaxation technique, the routine starts off, and they go through a full daily routine from morning 5:30 till 9:30 p.m. with various yoga sessions. And recently we have added Ayurveda and naturopathy, so a Panchakarma program gets incorporated in their daily routine. 1 week is the minimum period. Some people, we recommend them to stay for 2 weeks, and if they have chronic diseases, they stay anywhere from 4 weeks to 8 weeks. The data that has accumulated over the years has led to many PhD programs, and people are, as after they arrive, after the medical examination, they are allotted into various sections where different set of practices, specialists selected for their individual therapy, specific therapy for their individual need after a very thorough medical checkup will be monitored, and we have a team of each section is monitored by a trained MD and a trained postgraduate in yoga therapy, and all the MD and postgraduate diploma students who will be getting their training. That's the great experience that most of our students get while they work individually with all the patients. And so I'll be quickly running through all the sections that we go through. Section A is dedicated to oncology and neurology, and one of the common problems that we see in the oncology section is we get patients of various cancers at various stages, but this particular research data is from structured research projects which was conducted in collaboration with Bengaluru Institute of Oncology. These data are not from the residential program because they are all non-residential, working in an oncology hospital where people come for their routine conventional management, and they go through the whole program. For 1 hour every day they practice. These were all some of the data that we have accumulated. I showed some of these data, so I quickly run through them. The stage 2 and 3 breast cancer patients, they 6 weeks during radiation therapy, they were showing very highly significant improvement in their psychological morbidity and stress markers. Terminal stage 4 breast cancer patients showing better performance in their immune markers. The hospital stay for women who are undergoing breast cancer surgery was much lower in the yoga group as compared to the non-yoga group, and all the way along, right from the day 1, before surgery, post-surgery, pre-radiation therapy, mid-radiation therapy, post-radiation, chemo, etc., we were able to observe and document the anxiety and depression scores, and we were able to show that the improvements were all the way along, their depression scores were much lower in the yoga group. The quality of sleep, I think there is some problem with the projection. Quality of sleep is that, what's that? Quality of life was much better in the yoga group as compared to the non-yoga group. I can't see the quality of life. Okay. During chemotherapy, the mean toxicity score was much lower in the yoga group as compared to the non-yoga group. Maybe some adjustment has to be made in the projection. Okay. In the A section, we also teach treat patients with various neurological problems, chronic neurodegenerative disorders, multiple sclerosis, Parkinson's, people coming after head injury, spinal injury are very common these days, and we are getting very fascinating results. Very, very miraculous improvement. They have had head injuries, either they have cognitive impairment or performance impairment, neurological deficits. They have been going through physiotherapy for a few months and they come back and stay here for just 2 weeks and they get fascinating results. This was a very interesting data that we observed in collaboration with Dr. Gardner, who is speaking to in the afternoon today in this track about his experience. And in his Neuro-Rehabilitation Center, we have a student exchange program. For 3 months, our MD students go there and conduct small projects. And this particular study, we were able to observe the effect on urinary symptoms in MS patients. And look at this simple thing that we were able to give these participants who are having multiple sclerosis, wheelchair bound for almost 16 to 17 years. And the amount of improvement that we were able to observe in these patients for all wheelchair bound at the German center. In fact, our students learn German language, start learning, give instructions in German language, and it's very fascinating to see the results, and Dr. Gardner encourages them a lot. The post-void urine residual volume reduced. I think somebody has to make some adjustment in the projection.
Yes, we're trying to bring it down.
The incontinence impact questionnaire shows significant reduction, and urogenital distress was much lower, and the objective measure on ultrasound scanning of post-void urinary residual volume was much lower. In section B, we dedicate to respiratory and cardiology department. We live very near a very big multinational, multi-center Narayana Health City, where all our MD students go and get postings there to rotate for their training and internship. And also we conduct research projects there. And in cardiology, we were able to, what is this? The heading is missing. I think this is an asthma data, yes. This is the asthma data on asthma patients, 40 in each group, yoga and control, one of the PhD theses, where she was teaching yoga on a non-residential basis, 1 hour every day, and we had a lot of problem recruiting them. This was a project for a PhD student, even to recruit and randomize them into 40, and 40 was not an easy project. In fact, we had to go to Tamil Nadu to conduct camps and take data there, bring them to Prashanti for taking some more circular data, etc. And this was the result. They are all very highly structured, randomized controlled trials where we have been able to show significant reduction. I'm sorry about I'm not being able to show what exactly is the variable. Some problem with the projection. Those are all the, I'm sorry, the variable is not visible because of the projection problem. In Narayana Hridayalaya, we have collaboration. Patients are admitted there for bypass surgery. What we do is on the day before surgery, our yoga teachers sit with them, talk to them, give them the relaxation technique, deep breathing technique, lot of anxiety about the ensuing surgery, which is going to be in a day or two. So within 1 day, 2 days, we have to prepare them for getting ready for surgery. And immediate post-operative, while they are in intensive care unit, what are they supposed to be doing? And they come out, they are in the hospital just for 6 days. So within those 6 days, we should catch them several times in the day. So we have posted our teachers there long term, and we run a yoga department in a high-tech heart hospital, and we were able to conduct this Ayush funded project in which we were able to recruit 150 for yoga, 150 for non-yoga group, and we follow them up. 6 days during the surgery, immediately post-operative, what are the immediate changes? Then they come back for a 6 weeks review, 6 months review, 1 year review, and this is now ongoing. We are in the 5th year of follow-up, but this is 1 year data. Those who were below the BMI was significantly better in the yoga group as compared to the non-yoga group, and those who were really overweight had a much better, more significant reduction in their weight and body mass index. Most fascinating thing was in the ejection fraction. The pumping capacity of the left ventricle was much better in post-operatively in the yoga group who continued to do yoga with over a period of time. This was 1 year follow-up where the ejection fraction had improved significantly in those who had an EF below 50. This is being processed. Our section C is dedicated to psychiatric problems and mental retardation and other psychological problems. We have had publications, one thesis on schizophrenia with 2 papers published. Am I audible? No. And a depression project is ongoing, and we have had collaboration with the National Institute of Medical NIMHANS, Mental and Neurosciences, where Dr. Nagendra was a co-guide for one of the PhD students, where we got 2 publications on schizophrenia and yoga, and we also had studied some heart rate variability and awareness in schizophrenia patients. We work with long stay homes for the schizophrenics. We are very nearby. We have a very interesting long stay home where schizophrenic patients come from various parts of the world, and there is one Father Hank who runs this center. It's commonly said, many of your yoga teachers, it's commonly said that meditation should not be taught to schizophrenics. Understand, very clear contraindication. The reason, if they sit with their eyes closed for a period of time, more than 5 minutes, as I keep teaching the students, more than 5 minutes, their mind gets lost in their world of delusions and hallucinations. Therefore, it may aggravate the condition. Therefore, do not teach any meditation for schizophrenics. Therefore, we always teach them to do asanas. Asanas with eyes closed is fine. Pranayama is with eyes closed is fine. But they should be avoiding sitting in one single position, trying to do whatever meditative mantra, etc. we have taught to them, but we don't ever know what their mind is doing. Therefore, it's contraindicated. But here we introduce cyclic meditation. Cyclic meditation is a technique where we start using body movements for meditation. Something that looks like Tai Chi. Body movements, but continuous deep internal awareness and closed eyes. They have to be doing meditative practices with using body movements, about which you will be hearing in some other research track also. So we found the father hand's experience was very interesting. After they started doing this for about 2 months, because they are all long stay participants, living there for years, he found that they were becoming more aggressive. Obviously, we were all a little worried, but Father Hand says this aggressive behavior was something different, something unusual, which they had not observed earlier. The reason that they had become violent, they had become a little more angry was because for the first time they have started becoming aware of their problem, which is the biggest problem in schizophrenics. They are not aware that they are sick. So this awareness about their sickness helped these counselors to work with them and take them one step further. And their Father Hand continues to teach them cyclic meditation even today on a long-term basis, so that awareness of their illness is a very, very major contribution of yoga to these schizophrenics. Very fascinating data on autistic children. Again, a research, a PhD student's project. She runs a school for the autism children, and she registered for PhD with us, and she started making 2 group study, one group in her own school where she was teaching yoga to her children with autism. She was satisfying the specific criteria, and another school where yoga is not there, she compared matching groups, and then she was able to follow them up for 2 years. It's not easy to teach yoga to autistic children. It requires lots and lots of patience, and look at the fascinating results. The eye-to-eye contact was much better. This is 1 year follow-up and this is 2 years follow-up. 10 months and 20 months. And the eye-to-eye contact is something which is very difficult in autistic children. There was a highly significant improvement in their sitting tolerance, in their eye-to-eye contact, their body posture and balance, body awareness. She is the Dr.Nagarathna who conducts this program. Depth perception and balance and imitative skill. Reduction in imitative skill is a very important thing that we use in artistic behavior, self-stimulatory behavior. Arthritis is another area where we have been having very encouraging results. I just heard from one of you that the American Arthritis Society is now recommending yoga to arthritis patients, which is a very heartening thing to know. An orthopedic surgeon who registered for PhD. I am specifically mentioning that if there are any of you in the audience, you please register for PhD even from this country through VYASA on a distant mode, and you can start designing studies and then get your PhD from Ashwini University, the only yoga university in the world. So 125 for yoga, 125 non-yoga. People who are about to get registered or who have been recommended knee replacement or osteoarthrosis of the knee with a damage to the cartilage were the ones who were registered for the project, and they were taught all these Sukshma Vyayama practices. What are the results? The results were the early morning stiffness was much lower in the yoga group, significant reduction, almost 68%, 100%, as compared to the non-yoga group who were doing physiotherapy. This was a study where control group was not doing nothing. They were doing the standard physiotherapy with shock-wave therapy, physical exercises as recommended by the standard physiotherapy department, and yoga was the other group. So physiotherapy did help, but yoga was giving additional benefits. The lady who could not bend the right knee is now able to bend her knee. Yoga group also decreased total knee disability scores. All standard disability questionnaires were used, and we have 3 publications from this study. The genovalgum deformity, which is one of the very, why this is running so fast? Genovalgum deformity is something which is very effective, makes them limp a lot, and within these 12 weeks of the intervention, there was a significant reduction in the distance between the 2 knees when the knee was stretched and kept crossed. Then the lady who could not squat is now able to squat after doing the yoga. Back pain is another major area we come across. People who have been recommended surgery for prolapsed intervertebral disc are the ones who are recommended. In fact, most of the doctors in the vicinity now say, okay, if I have to open your back and give you a laser surgery, I can wait. You go to Prashanti and let me see. If you don't get well, you come back to me. Maybe I would have been able to, I would have had to refer not more than 1 to 2% of the patients for surgery. After they have been told that they need to undergo surgery, 95 to 98% of them manage to go away without surgery. This has become such a routine thing. Now, I don't have to meet our participants. Our therapist takes the MRI and say, oh, ye kuch bhi nahi hai, hum karenge. And with that, our fascinating results are coming. Because back pain, prolapsed intervertebral disc, sciatica are all very commonly seen with protrusion of intervertebral disc, prolapse, etc. It's a very common problem we come across. Again, 3 publications by Dr. Padmini Tekor on her study where they stayed for 2 weeks. 1 week they did yoga, and the following week we crossed them over for non-yoga and crossover design. First week non-yoga, second week yoga. One group, and one group first week yoga and first week non-yoga and second week yoga. And we were able to work with them and show very significant improvement in both the groups. Within 1 week, first and 7th day, significant reduction in osteoarthritis disability, spinal flexion, spinal extension, depression, WHO QOL, and diabetes is another area where we had our first publication from Royal Free Hospital in London, and these are all the practices that we teach them. This was again a randomized controlled trial where we were able to compare the standard conventional lifestyle change with exercise and diet and compare it with non-yoga group. What did we notice? We noticed that yoga was similar to exercise in reducing blood glucose, HbA1c, triglycerides, etc. But yoga was better than exercise in increasing the good cholesterol. Menstrual disorder, we have had 2 PhDs, menopause and PCOD. Which are the 2 projects in which we have been able to show significant improvement. Obesity, promotion of positive health are other areas where we use. The pediatric group of adults, we were able to demonstrate significant reduction in the sleep problems, which is very fascinating, that their sleep latency, the duration to fall asleep, the habitual sleep efficiency were all better in the yoga group, and positive health. What do our therapists do for our patients when they come there? What we teach them is to work on all 5 aspects of our personality, as you heard from Dr. Nagendra, that there are practices at all these levels, and help them to change their lifestyle by working on their mind. All our patients know how to reduce weight, what to do, what not to do. Education is there. But why they are not able to stick to their exercise or stick to their diet or come out of their bad habits or handle their stress? It's all because of the mind. Therefore, mind management we have to incorporate in all our daily routine. And we work on a basic set of yoga practices with breathing exercises, loosening exercises, Surya Namaskara. And based on the individual's capacity, individual's need, individual disease, this set gets changed with emphasis on avoid list and emphasize list. The breathing exercises, then comes the asanas, standing, prone, supine, sitting, followed by kriyas, Kapalbhati and Vamanadhauti once a week, and ending with deep relaxation. All kriyas have always to be followed by the deep relaxation technique. Then they all do pranayama, they all do meditation, they all do daily routine of bhajans and devotional practices with lot of theoretical backup, and do their Vedanta study regularly. Vibhagiya pranayama, and help them to slow down the breath and reach the state of deep dharana, dhyana and samadhi, and reach a state of expansion and slowness. So with these practices, plus bhakti yoga, as you heard from Guruji and Raghuramji, and reach the state of silence, we help them to become a master of their mind, change their response and reaction patterns, and work on their mind to change their lifestyle. And that is a whole of the integrated approach of yoga therapy, which is helping them to reach a state of total health and come to a state of blissful existence and freedom from disease. And most of our patients, follow-up is a very big problem. However much they show improvement, following them up, continuing to maintain their regular practice at home is one of our major challenges. And of course it is the disease that makes them continue to do their practice. If they are free from the problem, they stop their yoga practices. But as you and I know, yoga is not meant only for therapy. They should continue to grow and grow and grow and reach the heights of spiritual excellence, and that's where the yoga should lead us on. With this, let me stop here.